Have you ever held your cholesterol test results and felt overwhelmed, not knowing what you were really looking at? Does a high number automatically mean you need to start medication right away? Or is there something more important to understand before making that decision? There are so many rumors about cholesterol-lowering medications that they cause muscle pain, damage the liver, even lead to memory loss. But how much of that is actually true? And are you missing the chance to protect your heart just because of fear? Some people think taking medication means your body is failing, but to me, it's a sign of wisdom. Because while medication can't live your life for you, it can give you more time to live it fully, with the people and things you love. 1. When should you start cholesterol medications, and what's the truth behind them? When someone sees high cholesterol on their blood test, the first question they often ask is, do I need to start medication? But the answer isn't as simple as one number. As we discussed in the previous video, the decision to start cholesterol-lowering medication isn't based solely on LDL levels. It depends on your overall cardiovascular risk, age, health history, blood pressure, diabetes, lifestyle, and more. That's what modern medicine calls a personalized approach, rather than one-size-fits-all. And when it's time to start medication, people often ask, how do these drugs actually work? Do they really cause liver damage or muscle pain? What if I can't tolerate statins? Are there alternatives? These concerns are completely valid. Every year, we meet hundreds of patients who feel confused by internet rumors, half-truths, or just a lack of clear information. That's why in today's video, I'll walk you through each class of cholesterol medication, from statins to newer options like PCSK9 inhibitors, and we'll get honest and clear which meds work, what side effects are real, what's right for you, and how do you use them safely as part of your long-term heart protection plan. If you're feeling overwhelmed by a small pill with big controversy, this video is for you. 2. Types of cholesterol-lowering medications and how they work when your doctor decides medication is necessary. There's more than just statins. Today's modern medicine offers multiple drug classes, each targeting different steps in how your body processes cholesterol. Statins, the first and most powerful warrior statins, are the most commonly prescribed cholesterol drugs, and for good reason. They block your liver from making cholesterol, lowering LDL by 30 to 55%, raising HDL by 5 to 10%, and reducing triglycerides by 15 to 30%. But there's more. Statins also stabilize artery plaque and reduce inflammation, key ways to prevent heart attacks and strokes. Common types: atorvastatin, ROSUVASTATIN. B. Ezetimibe, the quiet cytokine blocks cholesterol absorption in your intestines, lowering LDL by another 15 to 20%. It's often added to a statin when the maximum dose still doesn't meet your LDL goal. CPCSK9 inhibitors, the Special Forces example, Evolocumab. These boost the number of LDL receptors in your liver, pulling more cholesterol from the blood. They're extremely powerful, up to 50 to 60% LDL reduction, but expensive and given by subcutaneous injection every 2 to 4 weeks. Reserved for very high-risk patients, those with repeat heart attacks or multiple cardiac interventions. D. Bempedoic acid, for statin-intolerant patients. This blocks cholesterol production upstream in the liver, without affecting muscles. Ideal for those who experience muscle aches on statins. EI fibrates, for high triglycerides. Unlike statins, fibrates don't reduce LDL significantly. Instead, they enhance the breakdown of triglycerides and are used in patients with very high triglycerides, especially those with diabetes and low HDL. F. inclisiran, the G-silencing tech. This small interfering RNA therapy silences the gene that creates PCSK9 in your liver. Given as a twice-yearly injection, it provides long-term LDL reduction, but is very costly. Used for patients with severe difficult to cholesterol. Each medication is a tool, and your doctor helps choose the right one for your body and risk profile. 3 side effects. What's real, what's rare? Worrying about side effects is one of the main reasons people hesitate to take cholesterol medications, especially statins. But let's break it down so you can see what's real and what's overblown. A. Muscle pain. Common, but often mild. About 5 to 10% of statin users report muscle aches, often in the shoulders or thighs, but only 1 to 2% of cases are truly statin-related. These aches are usually mild, temporary, and manageable, often solved by switching statins, lowering the dose, or using alternate day dosing. Key advice: don't stop the medicine on your own. Talk to your doctor. Think of it like shoes. If one pair hurts, you don't stop walking, you just change shoes. B. Liver enzyme elevation. Rare and reversible. Some worry statins damage the liver. In reality, true liver damage is rare, 1%, and usually mild. Statins don't destroy the liver, and in some studies they improve fatty liver in people with obesity or diabetes. C. Injection site reactions. Minor and temporary for injectables like Repatha. Mild redness or swelling at the injection site can occur. These reactions usually fade quickly and don't impact effectiveness. D. Severe muscle breakdown. Rhabdomyolysis. Extremely rare. This is the side effect many people fear, but it's extremely rare, less than 1 in 1,000, and mostly seen with very high doses or multiple interacting drugs. With proper dosing and monitoring, the risk is virtually zero. Bottom line: yes, side effects exist, but they are usually mild, rare, and manageable. The worst thing you can do is panic and stop your medication without medical advice. Stay informed, stay safe, and always work closely with your doctor. Point 4. Debunking common myths about statins. Over the years, I've had many patients return for follow-ups and say, "Doctor, I stopped taking my medication a few weeks ago. I heard statins mess with your brain, cause diabetes, and they're full of harmful chemicals." The truth is, these misunderstandings are causing far too many people to miss their window to protect their heart when it matters most. Let's clear up the confusion one point at a time. Myth 1. Statins cause memory loss or confusion. This is a common concern, but one with no strong scientific evidence to support it. Large clinical trials like Prosper and Ebbinghaus have followed tens of thousands of patients and found no clear link between statins and memory decline. In fact, statins may even help protect the brain's blood vessels, lowering the risk of stroke and vascular dementia, a common type of dementia in older adults. Myth 2. Statins cause diabetes. It's true that statins can slightly raise blood sugar in some people, especially those who are already at risk, such as people with obesity, pre-diabetes, or a strong family history. But keep this in mind: the increased risk of diabetes is small, about 1 in 255 people. Meanwhile, the benefit of preventing heart attacks and strokes is much larger, around 1 in 39 people. In other words, the benefits clearly outweigh the risks, and you can further lower your risk of diabetes by maintaining a healthy weight, eating well, and staying active. Myth 3. Statins are toxic. Chemical drugs. Actually, statins have a natural origin. They were first discovered in a type of mold called penicillin. To date, statins have been studied in over 100 million people. making them one of the most researched and safest drug classes in modern medicine. In fact, statins have more solid research behind them than many over-the-counter supplements being promoted online. Bottom line, what you hear isn't always the truth. Trust medical evidence, not rumors. If you're unsure, talk to your doctor, not Google or social media. 5. Personalized treatment strategy. Because not everyone is the same. One of the biggest shifts in modern cholesterol treatment is moving away from the one-size-fits-all approach. Each person has a different level of heart risk, so treatment goals must be tailored accordingly. Here are 3 common risk categories and their target LDL cholesterol levels. Moderate risk LDL goal, under 100 mg DL for people with no heart disease, no diabetes, no smoking, but slightly elevated cholesterol or family history. High-risk LDL goal, under 70 mg DL for people with conditions like diabetes, high blood pressure, or a history of mild heart attacks. Very high-risk LDL goal, under 55 mg DL for those who've had heart attacks, strokes, stents, or multiple artery blockages. This group needs tight control to prevent recurrence. Most treatment plans begin with statins because they are proven, cost-effective, and will, if statins alone don't get you to target, or if you have side effects like muscle pain or liver enzyme issues, your doctor may add ezetimibe to reduce LDL by another 15 to 20%. Or consider other medications like bempedoic acid or PCSK9 inhibitors. In summary, treating high cholesterol isn't just about a number, it's about understanding your entire health profile, lifestyle, and cardiovascular risk. Work with your doctor to build a treatment plan that's truly made for you, not too much, not too little. Because getting it right from the start is the key to long-term heart protection. 6. Final message: medication is only part of the solution. Lifestyle is the foundation. Many people feel uneasy or even embarrassed when they're prescribed cholesterol medication, as if taking it means they've failed. But here's the truth: taking medicine isn't a sign of weakness. It's a smart, proactive choice to protect your heart before something serious happens. Think of cholesterol medication like wearing a seatbelt while driving. You don't wear a seatbelt because you're a bad driver. You wear it because life is unpredictable. An accident may not be your fault, but that seatbelt can save your life. In the same way, cholesterol medication works quietly and powerfully to lower your risk of heart attacks and strokes, especially if you have risk factors. But medication is just one piece of the puzzle. Without lifestyle changes, its effect is limited. With lifestyle improvements, its effect can be multiplied. Start with small, simple actions. Eat less sugar and saturated fat, and more vegetables and fatty fish. Exercise regularly. Even just 30 minutes a day makes a big difference. Sleep well, manage stress, and stay emotionally healthy. And if you smoke, now's the time to seriously consider quitting. There is no pill stronger than your own decision to change, and no one knows your body better than you. If your test results are confusing or overwhelming, don't worry. Just start by understanding, taking small steps, and staying consistent. You're not alone in this. Your heart deserves daily care, and you hold the key to lifelong health. Conclusion: heart health isn't a sprint, it's a long walk, one step at a time. Understanding your cholesterol numbers, taking medication the right way, and living a healthy lifestyle, that's how you give your heart a quiet but priceless gift. If today's video has helped you see the path more clearly, I invite you to join this journey with me. Hit the subscribe button, like this video, and share it with someone you love, because sometimes the right information at the right moment can change everything. Thank you for watching. Wishing you good health and peace of mind always.